morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. So today, we will be discussing the episode 2 of our immediate and emergency care. So our guest speaker is in-house speaker from our clinic team, and she's also a licensed PT. So let's welcome Rachel Leon, PTRP. Hi, Rachel!
Hi guys, good morning again. I am here, Rachel, your physical therapist for today. So I am here to continue the discussion about immediate care and emergency care. So let's start. Let us know first what is immediate care. So immediate care is a treatment option that accommodate those who need to see a doctor now, although their condition may not be life-threatening. So usually this for immediate care, usually ito yung mga medical care facilities wherein yung patient nag-stick sila kay doctor to consult their condition. So, usually ito yung mga sport condition lang. So, for the next slide, we'll be mentioning those medical condition that would fall under immediate care. So, we have here sport injuries, sprain, strain, and dislocation, suspected fractures, ligament tears, cast or splint issues, cuts and laceration, overuse injuries, painful and swollen joint. We will be discussing further those sports injuries. What is sport injury? So, sport injuries are commonly caused by overuse, direct impact, or application of force that is greater than the body part can be structurally withstand. So, sport injury usually mga athlete yung nakakaroon nito. Syempre nga, sports nga. So, depende na lang siya sa MOI or yung mechanism of injury. Usually, yung iba overuse. So, halimbawa, for example, yung mga tennis players, so ang ginagamit nila is yung shoulder muscle nila. So, kaka-spike nila. So, yung activity na ginagawa nila, napapagod yung muscle nila sa shoulders. So, as the time goes by, yung muscle nila na wear and tear. So, overuse nga siya. For direct impact, so, pwede yung mechanism of injury niya is yung isang player nabangga niya isang player or kaya yung isang player na-fall siya habang nagki-kick ng ball sa soccer. Then application of force that is greater than the body part. So best example dito is yung basketball player na nag-dunk siya pero yung knee niya, so pag yung knee niya sobrang naka-extend, then kapag land niya sa lupa, naka-extend pa rin. So usually yung mga ligament natin dun, puwede siyang mapunit siya. So nagkakaroon siya ng injury. So ano ba yung mga common injuries na usually na experience ng mga athletes natin? So these common injuries are bruises, sprains, strain, joint injuries, and nosebleed. So for the next slide, so we will discussing the sprain, strain, injuries, swollen muscle, and Achilles tendon rupture. So sprain lang, so tandaan lang natin, it is overstretching or tearing of the ligaments po. So kapag sprain, ang tandaan nyo is ligaments. So anong function ni ligaments? So ligaments is kino-connect niya yung one bone into another bone. So kunyari ito yung one bone, tapos ito yung isa pa. Then this is the ligament. So para magawa mo yung movement na gusto mong gawin. So for strain naman, ang tandaan mo is this is overstretching or tearing of muscle or tendon. So involves dito si muscle and tendon. Kapag sprain, ligament. Then kapag strain, muscle and tendon. So ang kapag yung joint natin is na-twist or na-pull, ang nangyari nagkakaroon tayo ng sprain. So for additional knowledge lang, most common na na-sprain sa atin is yung ankle, then yung knee puwede rin siya mag-sprain, then yung wrist natin. So for strain naman, so most commonly strain na muscle natin is yung hamstring natin. So yung hamstring natin is usually located siya kunyari ito yung ano natin, yung lower part natin, this is the thigh part, then yung knee, then ito yung binti. So ito yung sa ibabaw siya is yung quad muscle, then hamstring. So kapag nagkaroon tayong strain, usually ang most commonly na strain na muscle is yung hamstring. Ano bang function ng hamstring natin? So si hamstring natin siya yung naghe-help para ma-flex natin or matupi natin yung tuhod natin. So kung mapapansin mo, kapag uupo tayo, nag-flex yung knee natin, kapag naglalakad tayo, kapag may inaabot tayo. So, usually ay yung nai-strain na muscle. So, ano po yung nai-strain na muscle sa atin? Yung sa may lower back natin. Usually, yung sumasakit sa atin. Kasi na-strain din siya. For the next one is knee injury. So, knee injuries could range from an overstretch to tears in the muscle or tissue in the knee. So, knee injury. So, pwedeng injury mo sa knee, pwede siyang muscle, pwede siyang tissues in the knee. So, marami kasing knee injuries na pwede nating i-mention. So, pwede rin na tayo magkaroon ng knee strain kasi maraming muscle na nakadikit doon. Knee injuries, puwedeng kang magkaroon ng fracture, knee injuries din 'yun. Then, usually kapag sa basketball player ang knee injuries nila nagkakaroon sila ng injury sa mga ligament. So, kung mapapansin mo yung mga sikat na basketball player nagkakaroon sila tinatawag na ACL, PCL na kung naririnig mo 'yun. So, maraming maraming knee injuries tayong puwedeng i-mention. Pero as a whole, knee injuries, ah, under siya ng immediate care kasi puwede tayong mag-apply ng first aid pero hindi enough 'yun kasi puwedeng habang tumagal yung oras mas maging ano yung injury niya. Parang 'di ba sabi nga nila, yung time is gold nga. So, habang tumatagal yung oras puwedeng mas malalala yung injury na meron yung isang patient. Swollen muscle, so swollen muscle may also be painful and weak. So, swollen muscle, accompanied siya ng sprain, strain, and knee injury. So, kapag nagkaroon ka ng sprain, naging swollen yung muscle. 'Pag nagkaroon ka ng strain, puwede rin mag-swollen yung muscle. Then knee injury, so kapag nagkakaroon depends sa mechanism kasi ng katawan natin na kapag halimbawa yung mga injury ngayon nagkakaroon ng swelling. So, swelling it means na yung katawan natin, naghe-help siya para gumaling or magkaroon tayo ng ano, meron yung katawan kasi natin may capability na i-heal yung isang body part na na-injured. So, swollen is one of the sign na yung katawan natin nilalabanan kung ano yung injury or meron tayong sakit. So, for Achilles tendon rupture, during sport, this tendon can break or rupture. So, Achilles tendon rupture usually siya, na kakaroon nito yung mga basketball player. So, Achilles tendon kasi is a strongest and largest tendon na meron tayo. So, makikita siya dun sa may ankle part natin. So, Achilles tendon, ginagamit natin siya kapag naglalakad, tumatalon, or nag-jump tayo. Tumatalon, nag-jump pa isa lang, then naglalakad tayo. So, paano malalaman kung na-rupture na yung tendon mo? So, may tinatawag tayong Achilles tendon test. So, kapag yung sa may part ng 'di ba kunyari ito yung paa mo, then yung sa may back part, kapag ini-squeeze mo yun, ang tendency ng foot natin is nagda-drop down. So, kapag ini-squeeze natin yun, then hindi siya nag-drop down. Ibig sabihin yung Achilles tendon natin is na-rupture niya. So, naputol na siya. 'Pag naputol yung Achilles tendon natin, usually ito, for operation na siya. Then siyempre for recommendation ni doctor kung ano ba, under ba siya ng rehab for therapy or magpapa-ano na siya, magpapa-opera. Kasi usually ang operation last, resolution na ni doctor. So, we have dislocation, fracture, and rotator cuff injury. So, dislocation, sport injury may dislocate a bone in your body, force out of the socket. So, sa body natin meron tayong usually may socket tapos yung bone. Ang meron tayo niyan is yung shoulder, sa may shoulder part natin and then sa may hip part natin. So, sa shoulder natin, so kunyari ito yung tinatawag na yung shoulder blade. In medical terms, meron tayong scapula na tinatawag. Tapos ito yung shoulder natin, yung humerus na tinatawag. So, halimbawa ito yung scapula tapos ito yung humerus natin. May mga para mag-stick yung bone na 'to merong mga ligaments and muscle naghe-help sila para hindi siya ma-dislocate or maalis diyan. So, maraming factor bakit nadi-dislocate yung isang bone natin. Bone fracture are also known as broken bones. Any break in your bones it is fracture. So, for fracture, marami kasing kinds of fracture. May tinatawag tayong transverse fracture, meron siyang two types, displaced and non-displaced. So, 'pag sinabing displaced, ibig sabihin nawala siya sa alignment. So, kunyari, Kunyari ito yung bone natin. So kunyari nagkaroon ka ng fracture. So 'pag sinabing transverse, 'di ba 'pag sinabing transverse 'pag gano'n? So ito nagkaroon ka ng hiwa dito, 'pag sinabi ng displace, so nakaganyan lang siya. Na-displace, so nahiwalay siya dun sa posisyon na 'yan. Pero transverse, in-transverse na line siya. Then meron tayong tinatawag na comminuted. From the word comminuted, yung fracture na type ng fracture natin nagkaroon siya ng ayan nabali yung buto mo pero may maliliit na part na nadurog. Then for green stick naman siya, yung fracture na green stick na tinatawag, nagkaroon ka ng fracture pero parang lamat lang, hindi siya tuluyang na fracture. So may lamat lang. Kunyari kalahati lang ng part ng bone mo yung nagkaroon ng fracture. Then for fracture, kailangan natin si doctor. Then kailangan, sabi kay doctor, kailangan niya mga laboratory test. Usually yun, x-ray to know ano ba, fracture ba talaga yung condition ni patient. Then kung ano na-recommend ni doctor kung isa-cement ba yan or for pinning yung ano mo, yung bone mo para 'pag nag-heal siya in proper alignment. Kasi usually yung iba kapag hindi sila ng concern nila kay doctor, "Self-clean hayaan mo na 'yan," nagkakaroon tayong deformity. Kasi yung katawan natin may kakayahan siyang mag-heal nga. So, halimbawa nag-heal nga siya pero in a wrong position, nagkakaroon ng deformity na tinatawag. So, maraming kinds na deformity. Minsan yung iba sabihin nila komang sila. Yung komang na yun sinasabi yun ibig sabihin lang nagkaroon na sila ng deformity. So, pangit yun kasi may mga activity na nagkakaroon ng limitation 'pag nagkaroon ka ng deformity. So for rotator cuff injury, rotator cuff keeps your shoulder moving in all direction. A tear in any this muscle can weaken the rotator cuff. So what is rotator cuff? So sabi nga rito, rotator cuff, ayun, kinikip niya yung shoulder natin kapag na-move tayo in all direction. So rotator cuff kasi consists of four muscles natin in shoulder. So, for acronym lang, then usually tinatawag din siyang sits muscle. So, we have supraspinatus, then infraspinatus, teres minor, and subscapularis. So, yung beginning ng letter nila, nagkaroon tayo ng word na sits muscle. So, siya yung nagko-compose of rotator cuff injury na nagki-keep ng shoulder natin in a proper place kapag nagmo-move tayo. Kasi kapag wala tayong sits muscle, pag ginalang mo 'yan, 'di na siya babalik sa tamang position niya. So naka-relay na lang yung shoulder natin. So ang pangit naman niya tingnan na kapag mag-move tayo nakababa na siya agad, 'di ba? So if ever nagkaroon tayo ng rotator cuff injury, si doctor kailangan natin. Hindi enough yung magkaroon lang tayo ng self-treatment or first aid lang. Kasi as sabi ko nga kanina, ulitin natin na kapag habang tumatagal mas nagiging serious yung injury kasi 'di pa tayo nag-seek agad ng puwede nating gawin. Hindi natin o kaya hindi mo finalo kung anong recommendation ni doctor. So for the next slide, for dislocation, so for further ano lang, discussion. So dislocation is an injury that causes the end of your bones out of position within the joint. So meron tayo sa picture, meron tayong ayan normal, may normal na part. Then meron tayong anterior dislocation and posterior dislocation. For anterior dislocation sa ano natin, sa shoulder natin yun eh. Pero puwede rin siya magkaroon ng anterior and posterior dislocation sa may hip part. Yung part na 'to, yung shoulder and hip natin na nagke-carry ng maraming percentage ng weight natin. Kapag wala 'tong mga 'to, ang hirap talaga kumilos. So kapag yung isang bone natin is na out of place, so hindi lang pala yung tao na out of place kundi yung bones din pala natin na tinatawag nating dislocation. So kapag na out of place yan, ang hirap na gawin yung activity na puwede nating gawin. So for dislocation, halimbawa nagkaroon ka ng dislocation, ano ba yung mga puwede nating gawin? So si doctor pagka nagkaroon ka ng dislocation, nagbibigay sila ng bandages. So usually may proper position. Ang mga nakita kong, may dislocation nilalagyan nila ng bandages. So kunyari nakaganyan si patient then ba-bandage yung ditong part, then support lang dito. Then depende rin kay doctor after mong magkaroon ng bandage, okey na ba yun or mag-a-undergo ka pa ng rehab. So for additional knowledge lang, common dislocation, usually makikita natin sa ankles natin, sa knee, sa shoulders, sa hips, sa elbows, sa finger and jaw. So itong mga 'to makikita mo yung, dislocation, between the joints talaga siya. Then symptoms of dislocated may include swelling talaga, bruising and pain. So kapag na-dislocate ka, halimbawa nagkaroon ng swelling, bruising and pain, expect mo na magkakaroon ka niyan. For sport injury, we have siyempre masyadong popular itong RICE method na 'to. So for acronym lang ang RICE. So R for rest, then I for ice, compression for C, and E elevation. May picture ako alam ko. Ayan. So for that, ayan. So for RICE, ah, R stand for rest. So bakit kailangan ba ng i-rest mo 'yun? Kapag nagbe-bear ng weight sa isang part, puwedeng mag-increase yung pain niya kaya kailangan nating i-rest siya. So, then for application of ice can help to reduce the pain. So, magkakaroon ka ng feeling of numbness o wala kang ma-feel. Then makatulong din siya for, i-reduce niya yung risk mo magkaroon ng inflammation. Then for compression, naghe-help na magkaroon ng mas bigger or hindi magkaroon ng mas malaking inflammation dun sa part na nagka-injury. Then elevation kapag inelevate mo kasi isang part, siyempre bababa sa law of ano natin. So parang ganito. So may alcohol ako dito. Pag inelevate mo 'to, ang mangyayari yung tubig babalik siya dun sa sa katawan natin. So sa picture na 'to, so magandang pinaka-best na picture na nakita namin. So 'yan, siyempre si patient pinag-take natin ng rest. Makikita niyo sa notes sa baba, do not apply ice and compression at the same time. So step by step nga siya, so hindi mo kailangan siyang pagsabayin. So for elevation, hindi mo siya kailangang hawakan ng matagal, puwede kang mag-put lang ng pillow para hindi ka mangalay. Then for compression, always remind po na kapag mag-apply ka ng bandage, hindi gano'n kahigpit para may circulation ng blood pa rin na nangyayari. Kasi kapag nagkaroon ng too tight yung pagkakalagay mo ng bandage, ang mangyayari, mangingitim yung distal part ng affected part. So, mangyayari yun, magiging bluish yan. So, walang circulation na mararamdaman. Combined rest and elevation with compression. Ayun yung pwede. Pinagsabay mo si ice and compression, ayun ang hindi pwede. Okay? Then use elastic bandage only in the first 24 to 48 hours after the injury. Kasi for first to 24 hours usually ayan yung nagkakaroon ng inflammation. Then siya lumalaki. Kailan ba tayo for sport injuries, ano ba yung magpo-prompt sa'tin na mag-seek na ng emergency care? So, kapag nagkaroon tayo ng severe swelling and pain. So, nag-apply na tayo ng first aid pero hindi pa rin siya nawala. So, isipin mo na mag-emergency ka na. Kasi baka may ibang reason pa yan bakit hindi pa rin siya nawala. Though, nagkaroon ka na naman ng first aid, then visible lumps, bumps, or other deformities. So, as mentioned nga kanina, deformities, bad sign for prognosis. Pag nagkaroon ka ng lumps, bumps, deformities, siyempre, unang-una, in physical appearance, pangit siya tingnan. Then pangalawa, puwedeng madamay ibang organs mo. Halimbawa, nagkaroon ka ng deformity, halimbawa sa likod natin, spine, special part 'yun, may mga nerves na dumadaan 'yun. So, kapag nagkaroon ka ng deformity do'n, ang possibility is maipit yung mga nerves na dumadaan. Puwede rin 'yun sa ibang part, halimbawa nagkaroon kang deformity dito sa may siko, may mga nerves na dumadaan diyan kapag naipit 'yun, magkakaroon ka numbness, then mawawalan ng supply 'yun. Kapag 'di mo nagalaw 'yun, liliit yung muscle mo. Then ang mangyayari, sobrang weak na nun. Di mo na magagawa yung activity na ginagawa mo like the usual. Then popping or crunching sound when you use the joint. Popping and crunching sound, halimbawa may sport events ka, nakarinig ka ng popping or crunching sound, ibig sabihin nun, puwedeng yung ligament mo naputol na. So, medyo serious yung injury na yun. Then weakness or inability to put weight on the joint, ibig sabihin nun, puwedeng nagkaroon na ng punit dun sa ligament or muscle mo, which is serious siya na need mo na pa-consult kay doctor. Depende 'yun kung gaano kalala yung pagkapunit nung ligaments and muscle mo. Then if you experience any of the following after injury, like difficulty of breathing, dizziness, and fever, ayun, for emergency na talaga siya. So for the next slide, so for emergency, so let us know what is emergency care. An emergency condition is the one that can permanently impair or endanger your life. So we have chest pain under emergency care, stroke, head injury, abdominal pain, loss of consciousness, shortness of breath, bleeding, broken bones, and major brain. So let's discuss further those conditions. Chest pain usually described as burning, pressure, or tightness. So for chest pain, usually ito yung mga patient na nagko-complain sakit ng dibdib ko and yung kamay nila is nakalagay sa dibdib. So ang tawag natin dito is Levin sign. Chest pain with rapid pain to the arms, back, neck, and jaw. Kapag impending symptoms for heart attack is chest pain, then nagkaroon siya ng rapid pain sa back, neck, and jaw. So for emergency siya. Then for another symptoms na dapat alamin mo for emergency na to is nausea, yung na-attempt ka mag-vomit, then vomiting, nasusuka ka na talaga, or unexplained indigestion. So if ever na karoon ng chest pain, then accompanied by rapid pain, yung mga na-mention ka kanina, back pain, neck or jaw, then nausea, vomiting, and unexplained indigestion for emergency. Emergency na siya din, call 911 or local emergency number. Then for the next condition, we have dyspnea or tinatawag nating shortness of breath. So other symptoms may occur in absence of chest pain, including this. So palpitation, dizziness, and malaise. So palpitation, it means that your heart muscle, so masyado siyang nagko-contract. So bakit ba nagko-contract masyado? Ibig sabihin, gusto niyang supplyan pa ng blood yung mga part na wala o kaya meron ka ng heart condition talaga. Then dizziness, yung it means na lack of blood supply na yun. Kaya yung puso mo nagpa-pump siya ng todo-todo para ma-compensate niya yung part na may kulang ng blood supply. Then malaise means na nagkaroon ka na ng overall body weakness. So nanghihina ka na. Ba't ka nanghihina? Kasi wala ka ng blood supply. These atypical presentation are more common in females, the elderly, and diabetic patient. So if ever na may kasama ka ng matatanda, then diabetic pa yan. Then nakita mo ito, nahirapan na siyang huminga. Then may other associate symptoms, palpitation, dizziness, and malaise. For emergency na siya. So for the next slide, we have stroke. So what is stroke? Stroke is a medical emergency that happens when the blood flow to your brain is interrupted. Without blood, your brain cells start to die. This can cause a serious symptoms, lasting disability, or even death. Stroke, for layman's term, kapag nawalan na ng supply yung dugo yung brain natin, ibig sabihin pwede siyang mag-lead sa stroke. So we have three types of stroke. So we have transient ischemic attack, the first one, o tinatawag ng TIA. Usually ito yung sinasabi ng mga ibang tao na, nagkaroon siya ng mild stroke. So bakit ba sinasabi nilang mild stroke lang? Transient ischemic attack is anything that temporarily blocks blood flow to your brain, causes a TIA, or yung transient ischemic attack. The blood clot and the TIA symptoms last for short period of time. So ito, usually within 4 hours, nawawala na yung symptoms. So, sinasabi lang nila mild. So, okay ka na, okay lang yan. At least ang swerte mo, mild stroke lang yung na-experience mo. So, for the next type of stroke, we have ischemic stroke. So, medyo ano na siya, medyo malala na yon, ischemic type stroke. Ischemic type of stroke, it is maybe due to atherosclerosis or atrial fibrillation. Sabi niya, ano ba yung atherosclerosis? Pinagsasabi niya ito. So, pag sinabing atherosclerosis, it is the plaque formation or yung mga taba nag-accumulate na dun sa daanan ng blood natin or yung blood vessel natin. Kain ka ng kain ng taba, di yung tabang yun, naiipon siya na naiipon na nagkakaroon ng blockage dun sa daanan ng blood vessel natin. Then, for atrial fibrillation, it can lead to ischemic stroke. Pag sinabing atrial fibrillation, meron tayong problem sa heart. So, yung pag-pump ng yung heartbeat natin is masyadong mataas. Ibig sabihin merong taba na naipit sa may heart natin. Then halimbawa nagalit ka, ano ba yung reason? Tumaas yung blood pressure mo. Puwedeng kumain ka ng taba uli or nagkaroon ng event na for emergency. O kunyari nag-away kayo sa family mo, tapos yung taba dun sa may heart mo, na-dislodge or natanggal. Then dumaan siya dun sa blood flow na daanan. Then napunta siya dun sa maliit na part, hanggang sa nakarating siya sa brain, dun sa pinakamaliit na part. Siyempre, kung yung maliit na part na yun napasukan na siya, and yung sa supplyan nung yung daanan na yun may susupplyan na major na organ, siyempre ang mangyayari, may stroke ka din. Usually, ang stroke, pag sinabi nating nagkaroon ng taba sa brain, stroke yun. Pero 'pag nagkaroon ka ng taba, may harang ka sa puso, ang tawag dun, meron kang ano, myocardial infarction na ang reason niya is taba din pero sa puso naman napunta. Okay, for the next type of stroke and the last one type of stroke, we have hemorrhagic stroke. Ano bang naiisip mo 'pag sinabing hemorrhagic? Ang ako naiisip ko, 'pag sinabing hemorrhagic, madugo. 'Pag sinabing hemorrhagic daw, it is maybe due to aneurysm or arteriovenous malformation. 'Pag sinabing aneurysm, naririnig niyo 'to, namatay si ganito kasi aneurysm, ganyan. For unknown reason, kasi yung blood vessel natin kasi composed of 3 layers siya. So, for unknown reason, yung blood vessel may isang blood vessel tayo sa isang tao, 'no? Ito 3 layers ta's yung isa 2 layers. Siyempre may dadaan diyan na dugo. 'Pag tumataas yung pressure natin, ang nangyayari dun sa blood vessel natin is nag-e-expand. Yung blood vessel natin para siyang lobo din na kapag tumaas yung pressure, lumolobo siya. Then halimbawa ito, 3 'to, kaya niyang ma-accommodate yung pressure na yun. Pero yung 2 na layer hindi niya kayang i-accommodate. Ang mangyayari dun sa 2 layer na yun, instead na mag-expand siya ng gano'n, magkakaroon siya ng tinatawag nating parang ballooning, parang lobo talaga siya. 'Di ba 'pag ang lobo, sobrang taas ng pressure niya, ang nangyari is pumuputok. Kaya yung dugo lumalabas. Kaya sasabihin nila 'pag hemorrhagic, madugo, which is hindi naman talaga dapat. Si artery kasi ang ginagawa niya, nagsu-supply siya ng blood away from the heart while si vein towards the heart. So, kay artery kasi ang pressure dito is sobrang high, then kay vein naman is sobrang low. Brain mo, si artery din vein nagdikit sila. Ito sobrang taas ta's biglang baba. Parang 'di ba parang nakakahilo. Ang tanong dito is kaya ba ni blood vessel i-accommodate yung sobrang taas ng pressure ta's biglang baba? Kaya ang nangyayari is pumuputok din siya kasi hindi kaya ni blood vessel. So, for the next slide, I'll be sharing with you how will you able to know kapag si patient nagkaroon ng stroke. So, yan, we have a fast stroke test. So, fast, for acronym lang siya, as in face, arm, speech, and time. So, sa face, ano bang gagawin sa face? I-ask mo si patient na mag-smile. So, hindi mo lang siya i-ask na mag-smile just to, wala, gusto mo lang pagtripan, ganyan. Ang titingnan mo is yung angle ng smile nila. So, usually kapag pinag-smile mo yung normal na tao, yung angle ng smile nila is pantay lang. Pero kapag nagkaroon ng stroke yung patient, ang nangyayari yung isang, angle ng ano niya, ng mouth niya is naka-down, yung isa naman naka-up. So, ibig sabihin, uneven yung face niya, yung isa nag-weak na kasi wala ng supply, hindi niya na magawa yung activity na yun. Then, bakit kailangan natin i-check yung isa naman yung arm, raise mo yung arm. Kasi 'pag face lang yung tiningnan natin, hindi naman lahat na kapag chineck mo hindi pantay yung face, stroke agad 'yan. Kasi may isa pa tayong condition na kapag hindi pantay yung face, baka puwede siyang may Bell's palsy, hindi naman stroke 'yun. Sa 'pag Bell's palsy kasi ang involved lang mukha. Pero kapag stroke, ang involved niya puwedeng yung mukha, kalahati ng katawan, gano'n. So, eto importante na i-check mo rin yung arm niya. So, i-ask mo si patient na i-raise niya yung arm niya. Pero 'pag si patient ni-raise niya ng konti biglang bagsak agad. Ta's yung isa compare mo, laging iko-compare mo sa kabila. Kapag kinompare mo, yung isa nagawa niya naman ng normal pero hindi bumagsak. Bakit yung isa normal, yung isa hindi? Kasi yung manifestation ng stroke, kalahati siya. Then i-ask mo siya to say something like puwedeng itanong mo na rin sa kanya, sabihin mo nga yung pangalan mo, sabihin mo nga 'to, ganyan, ganyan. Bakit tatanungin mo siya? Sa stroke patient kasi, yung the way sila magsalita, yung speech nila is naapektuhan. So, sa brain kasi natin merong tinatawag nilang cranial nerve na 'pag tinamaan yun, may specific na function yun sa part na sa katawan natin. Kunyari ang natamaan is yung sa language natin. So, for stroke puwede yan, mapapansin mo rin yan, yung speech niya is naiba. Then time, 40, if you observe any of these symptoms, siyempre call 911 immediately kasi time is important kasi habang pinapatagal mo pa siya, puwedeng mas lumalala or mas nawawalan ng blood supply yung brain natin. We have head injury. So what is head injury? A head injury is any trauma to the skull or brain. The injury may be only a minor bump on the skull or serious pain. So pwedeng yung injury mo is close injury or open injury. So paano mo malalaman kapag close injury? So any head injury, so nagkaroon ng close injury, 'pag sinabing close, ibig sabihin hindi masyadong madugo. Kung makikita mo madugo, nasa loob siya, hindi mo siya makikita. Mechanism of injury kapag nagkaroon ka ng close injury sa head, ito yung mga pasyente na nabagok, pero hindi dumugo yung ulo, ganyan. Nabagok sila. Yung brain kasi natin, halimbawa ito yung brain natin, may tubig yan. Tinatawag natin cerebrospinal fluid. May tubig sa brain natin, then until dun sa spinal cord natin na nagsa-supply. Halimbawa, may bumangga, alam mo nasa kotse ka, may bumangga sa likod. Ang nangyayari, yung tubig, 'di ba 'pag nag-ano ka ng 'pag shinake mo yung isang bottle, ang mauunang mag-aano is yung brain natin ta's magfa-follow si tubig. Kasi mabigat yung brain natin tapos susunod si tubig. So, ang mangyayari poprotektahan niya yung part na 'to, pero hindi niya maprotektahan yung nasa unahan. 'Di ba, ito yung brain natin ta's may tubig, tapos yung skull natin. Sa skull kasi natin merong edges dun na matulis. So, puwedeng masugatan niya yung brain natin kapag walang tubig or cerebrospinal fluid sa part na yun kapag nauntog ka, nabagok ka, ayun close injury. For head injury naman na open injury, ito yung mga nagbaril sa ulo or meron siyang stab sa ulo, open injury. Nakita mo na may dugo, nakita mo na may sugat siya sa labas. Okay? Ano ba yung mga dapat nating tandaan kapag head injury yung case? So, for the next slide, yan. Things we should know. So, in the first 24 hours after a mild injury, a person should ask to check them or monitor them. Then, if a person loses consciousness or sign of confusion or memory loss, it is vital to see a doctor. So, bakit ba daw need natin monitor yung isang tao kapag nagkaroon ka ng mild injury sa head? Then, first 24 hours lang kasi may iba na tao na first 24 hours, nawawalan na sila ng consciousness, then hindi na sila oriented. Ibig sabihin baka further, medyo severe na yung injury sa brain mo. Kapag nagkakaroon ng head injury, may iba na hindi naman nawawalan ng 'yun, hindi naman sila nawawala sa consciousness or meron pa silang memory. Hindi sila nalilito lagi, okay? Then, a person should avoid using drugs, alcohol, driving, playing contact sports after head injury. They may need to take time off or off work or school. So, bakit daw need nating avoid? So, kung mapansin nyo, need nating avoid yung drugs, driving, playing contact. Kasi itong mga to is one of the reason bakit nagkakaroon ng head injury. Kasi nakainom siya, nag-drug siya, or nagda-drive siya, or playing contact sports, puwedeng nauntog siya or nag-dive siya sa swimming pool na masyadong maano yung impact ng tubig or nauntog siya dun sa tiles mismo, edi gano'n. So, for the next slide, we have severe head injuries require immediate medical condition. Anyone who sees someone with symptoms of severe injury should call 911 or their emergency number. It is best not to move a person in severe head injury to avoid making their injuries worse. People should also not attempt to remove a person's helmet if they have wearing one. So, sabi din nila sa ibang bansa kapag, alam mo, ikaw, masyado kang mabait, tapos gusto mo tumulong, mas okay na hindi ka tumulong dun sa ibang bansa. Kasi, katulad ng case na yan, tumulong ka, di mo naman ang gusto is maging mas worse pa yung condition ng patient. Kasi may mga situation katulad niyan, nagkaroon ng head injury, wag mong galawin yung ulo. Kasi bakit? Kapag ginalaw mo yung head niya, puwedeng, mas mag-aggravate yung symptoms niya or, ah, halimbawa nagkaroon na siya ng head injury dito sa ulo, then siyempre ano na yun, 'pag ginalaw mo puwedeng mas lalo siyang maimpit yung nerve na nagsu-supply or yung nagsu-supply for your consciousness is lalong naputol dahil tinulungan mo siya or nabomba yung ulo. Dapat kasi ang maggagawa niyan is yung may alam lang, medical practitioner na may alam for moving the head or transferring the employee to the emergency ambulance, no? So for the next slide, we have abdominal pain. So abdominal pain is the pain that you feel anywhere between your chest and groin. This often referred as to stomach, groin, or belly. So malalaman mo kapag abdominal pain is for emergency na kapag, for the next slide, abdominal pain as emergency. So, syempre check mo pregnant yung employee or yung patient kasi puwedeng manganganak na siya. Then next is check mo if yung pain niya is started within a week of having abdominal surgery or GI procedure. So, if ever kasi 'di ba kapag naoperahan ka na dapat okey ka na, then siyempre may rest 'yun. Kapag within the week di ka pa rin okey baka may activity ka na ginawa na nag-trigger or mas nag-aggravate na bakit nagkaroon ka pa ng pain imbes na okey ka na, okey? You have ever had a gastric pasby or colostomy or bowel resection. So, same din 'yun sa sinabi kong surgery. Then, if your pain started shortly after you experienced severe abdominal trauma. So, 'pag nagkaroon ka ng trauma dito sa may abdominal part, then dun lang nag-start nung pain mo. Tapos hindi pa siya okey for emergency na 'yun kasi puwede yung abdominal trauma na 'yun, puwedeng sa accident, ganiyan. And depende sa pain scale na meron si patient. Alam mo 10/10 na 'yan, siyempre severe na 'yan, then seek for emergency ka na. Then for abdomen appears bruised or rapidly expanding in size. So, yung ibang patient na halimbawa may bruise na siya or may mga pasa ka nakita, then nag-e-expand yung size niya, yun, loss of consciousness. So, loss of consciousness, so fainting occurs when our brain temporarily doesn't receive enough blood supply. So, causing you to lose consciousness. This loss of consciousness is usually brief. So, sobrang linya lang. So, kapag feeling mo, mahimatay ka na, upo ka, pahinga ka, or puwedeng mahiga ka. Para alam mo 'yun, pahinga lang din para hindi matuloy siya into to reduce daw yung chance of fainting, do not get up too quickly. Place your head between your knee if you sit down. So, siguro na-experience niyo na rin 'to na kapag nakahiga ka ta's bigla kang tayo, so biglaan yung tayo mo na yun, ang mangyayari kasi is yung blood supply mo bumababa agad. So, nawawalan ka ng blood supply sa brain. So, ang pwede mong gawin dun is i-place mo yung head mo between your knees and if you sit down. So, pwede yun kasi pwedeng tumulong siya mag-backflow yung blood sa brain mo. Then, if someone is faint or nahimatay siya, ano pwede natin gawin? So, higa mo si patient. So, yung back niya is nakalay down sa lapag. Then, check mo if may injury si patient, if kung ano siya, uminga pa siya. Then, kapag ganun, erase mo yung legs niya above the heart level or about 12 inches. If possible, iloosen mo yung belts, collar, or other constrictive clothings. Kasi pwedeng nag-pain siya kasi hindi siya makahinga or kulang ng blood supply kasi nga sobrang higpit ng pagsuot mo or anything na nakatali sa'yo. Okay? To reduce the chance of fainting again, don't get the person too quickly. So, as mentioned kanina, if person doesn't regain consciousness within 1 minute, call 911 or local emergency number. Bakit within 1 minute? So, si brain natin may capability pa siya na mag-function ng ilang minutes. May capability siya mag-function ng ilang minutes ng walang blood supply. Okay? Then, for checking ng breathing, if person isn't breathing, begin CPR. Call 911 or local emergency number. Continue CPR until help arrives or a person begins to breathe. So, CPR, we have, dito, for the next slide, we have a picture. So, we have step-by-step CPR. But again, if you're not confident to perform CPR, uh, wait ka na lang dun sa well-trained or kung sino man yung kasama mo dun sa lugar na yon na may alam ng CPR. Better, siya na lang yung paggawin mo ng CPR. So, we have a basic step for CPR. Shake and shout, sabihin mo, "Hey, hey, are you okay?" Then, two, call 911. Then, check the breathing. Then, place your hand at the center of the chest. Push hard and pass about twice per second. Then, if you had training, repeat cycle of 30 chest pushes and rescue breaths. So, and ayun yung step by step by CPR. Then, for the next slide, we have bleeding. So, we have here the most scenario kapag nagbe-bleed ka up or emergency na pala to. So, kapag yung patient is into shock, nung tinatawag ng hypovolemic shock, sobrang siyang nawalan ng dugo. Meron namang case na nagkaroon siya ng fever, may condition na ganun. Sobrang taas ng fever niya, may bleeding na rin siya. Then, kapag yung bleeding natin, hindi siya, cannot be controlled by using pressure. Di ba pag may dugo tayo, para hindi tayo mawalan ng para hindi maubos yung dugo natin is nagkapit tayo ng pressure. Pero kapag hindi pa enough yun, better kumontak na sa call 911. Then the wound requires tourniquet. So, yun nga. Kapag hindi enough yung pressure, dugo pa rin dugo, pwedeng mag-tourniquet ka siya. Pero usually, yung mga wound na nag-allow ng tourniquet, for emergency na siya. Okay, bleeding was caused by a serious injury. So, depende kung gaano ka-serious yung injury niyo. Kasi serious injury, so pwede ka mawalan ng maraming blood supply talaga. Okay? Then, foreign objects are stuck inside the wound. So, foreign object, na-stuck yan dyan, pwede mag-lead into infection kasi yun din. Lalo pag di natanggal. Okay? Then, the wound appears to be infected. Paano malalaman kapag yung wound mo is infected? Siyempre, nagsiswell siya. Merong leaking of whitish yellow or brown pus or redness. Then, the injury occurred due to a bite from an animal or human. Yun, for emergency siya kasi may iba lang pag galing sa animal, pwedeng, ayun, may rabies or injury, a bite from human. Pwede rin naman kasi kapag galing sa human, pwede may allergies, ay meron din tayong rabies na makuha. Kasi, yun. Okay, broken bone. So, a fracture is a broken bone. It requires medical condition. A broken bone is a result of a ear trauma or injury. Call 911 or local emergency number. So, what you need to do if someone, yun nga, nagkaroon ng fracture. So, a person is unresponsive, isn't breathing or isn't moving, begin CPR if there is no breathing or heartbeat. If there is heavy bleeding, we could do the gentle pressure or movement causes pain. The limb or joint appears deformed, then the bone has spears in the skin. Injured or legs such as toe or finger is numb or bluish at the tip. Okay? Ibig sabihin lang nito, nagkaroon ka ng fracture, then nawalan ng supply yung part na yun, kaya nag-numb siya and bluish. Okay? Then you suspect a bone is broken in neck, head, or back. So pag nagkaroon ka ng fracture sa neck and head, possible medyo ano siya, serious siya kasi sa may head and neck natin, andirito yung nagsusupply sa paghinga natin. So medyo serious talaga siya kasi buhay na natin talaga yung andyan. So do not move person except if necessary to avoid further injury. Take this action immediately while waiting for medical help. So, stop mo yung bleeding, immobilize mo yung body part, then apply hot packs to limit swelling and help relieve pain. Then for the next slide, we have to last one, we have major burns. So, major burns, nagkaroon ka ng burn, pero is medyo malaki yung percentage na burn sa skin mo. Pwede mong gawin until the emergency arrives. So, protect the person from further harm. Kapag pinabayaan mo lang yan, anong mangyayari? Masusunog din siya. So, make certain that the person burn is breathing. So, check mo kung humihinga pa ba siya or hindi na. Remove jewelry, belts, and other restrictive items kasi pwede siyang mas uminit pa. Okay? So, mas makakadagdag sa nararamdaman mong burn or puwedeng magdulot ng burn pa kasi nga mainit yung part na yun, which is yung jewelry belts and other restricted items na metal na alam natin na conductor ng heat. Then cover the area of the burn. Why you need to cover the area of burn? To prevent siyempre infection, especially kapag naka-open lang yung burn na part. Temperature natin is biglang bumaba. Okay? Then elevate the brain area where you need to elevate for elevate the brain area, why you need to elevate the brain area. Pwede kasing magkaroon ng possibility na magkaroon agad sila ng inflammation. So, kapag inelevate mo yung area na na-burn, ang mangyayari nun, yung tubig na pwedeng na-accumulate dun is mag-backflow sa body mo. So, ma-prevent yung further na pag-inflammation ng part na na-burn. Then watch for sign of shocks. And that's all for my wellness presentation. I hope you will learn something from me. Thank you.
All right. So, it seems that you have gave some very informative discussion about emergency care, when to go to a doctor, and when to consult. Sometimes we have also to consult the doctor even if the condition is not life threatening. Thank you so much for that, Rachel. So, if you don't have any questions, you can reach out to our nurses or the clinic team. You can just dial 420, or you can just send us a Skype message at APOSI Clinic team. So thank you so much for your time, guys. Have a great day and have happy and prosperous New Year to everyone. Bye.